Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. How sex drive changes as you age. There's no specific age for when people stop being sexually active, although age and sex drive are closely related. There are differences between how the reproductive organs change in people assigned male or female at birth, and the life cycle stages at which libido, sexual desire, drops off. /r/n/r/n Your personal sexual appetite is determined primarily by brain function, hormones, and beliefs and attitudes about sex. It can change because of your mental state, stress levels, overall health, and long-term hormonal changes. /r/n/r/n This article looks at how your libido is predicted to change in each decade of life, whether it's sex in your 20s or sex in your 70s. It also offers ideas about how you can increase your sex drive at any age. /r/n/r/nLWADann Tardif Getty ImagesrnrnrnVerywell Health acknowledges that sex and gender are related concepts, but they are not the same. /r/n/r/n Research studies sometimes don't use the terminology in this way. For example, terms that describe gender, woman, man, may be used when terms for sex, female, male, are more appropriate. /r/n/r/n To reflect our sources accurately, this article uses terms like female, male, woman, and man as the sources use them. /r/n/r/n The rise and fall of sex drive with age is different for different sexes. /r/n/r/n Hormones, hormonal birth control, pregnancy, and menopause all play a role in female libido. This causes a lot of fluctuation in people with vaginas. /r/n/r/n For a person with a penis, the primary sex drive influences include testosterone levels and overall health. While testosterone is thought of as a male hormone, females have it, too. /r/n/r/n This means that there are consistent patterns in sexual and reproductive health across a lifetime for both males and females, though each person is different. /r/n/r/n Our libido will naturally change with age, but the most important thing to remember is that libido is a reflection of your own personal desire for sex. Two people of the same age and background can have different desires for sex, and that's okay. /r/n/r/n Regardless of biological sex, testosterone levels are high in your 20s. Sex drive generally is, as well. /r/n/r/n In males, testosterone levels peak at 18. They start a slow decline after that. But they're generally high enough through this decade to support a healthy libido. /r/n/r/n Female fertility starts to decline in the late 20s even as sexual desire increases, though experts don't fully understand why. On the other hand, many females report lower sex drive in their 20s and 30s, often attributed to using hormonal birth control and/or medication to treat depression. /r/n/r/n Birth control pills may have an impact on female sexual drive, but the research on hormonal contraceptives and their effect on libido is mixed. /r/n/r/n Testosterone continues to decline through the 30s. In males, some studies suggest the decline may speed up to about 1% per year until about age 40. The drop in libido may become more noticeable. /r/n/r/n For many females, this is when sex drive peaks. Sexual fantasies may increase. You may find yourself having more frequent sex and having it earlier in your relationships. /r/n/r/n This may be a function of the biological clock and reproductive priorities. Fertility begins to decline by age 30, and the decline accelerates by your mid-30s. /r/n/r/n According to a British study, men experience a dip in libido between ages 35 and 44. Women have a similar dip later between 55 and 64.r/n/r/n. Both males and females experience physical changes in their 40s that have impacts on sexual behavior. /r/n/r/n. In males, their erections become less rigid and they start desiring sex less often. Erectile dysfunction, ED, starts becoming more prevalent. In general, the male refractory period, time after orgasm during which a person is not sexually responsive, lengthens with age. /r/n/r/n. For females, perimenopause, the lead up to menopause, typically starts somewhere in the 40s. That means declines in estrogen, female hormone, levels. /r/n/r/n. Lower estrogen can mean vaginal dryness, which can lead to painful intercourse. Testosterone tends to decline, too. This can all lead to a lower sex drive. /r/n/r/n. In the 50s, both males and females report declines in sexual interest and in how much sex they have. Many of the changes are physical, like ED in males. It affects half of all people with a penis between the ages of 50 and 59. /r/n/r/n. Other health and lifestyle issues that emerge during your 50s can affect male sex drive and performance, too. They include /r/n/r/n. Females may experience reduced vaginal lubrication, fewer orgasms, and other changes due to age and menopause. They also may begin to feel the effects of underlying health conditions. /r/n/r/n. In their 50s, people may be taking medications that change their sex drive. For example, high blood pressure medications like Lopressor, metoprolol, or thiazide diuretics may contribute to ED in males. On the other hand, drugs like Vyleesi, bremelanotide, may be used to boost libido in females. /r/n/r/n. Some research notes that sexual desire, activity, and function remain strong during your 50s. Some studies suggest that your sexual satisfaction isn't related to your age at all, but it does correlate with your overall health and relationship status. /r/n/r/n. Sexual dysfunction, chronic illness, and the death of a partner all become more common after age 60. And they all contribute to a continued decline in sexual drive and activity. /r/n/r/n. However, that doesn't mean you should expect to stop having sex as you get older. Research suggests that people in their 60s and beyond report active, fulfilling sex lives. /r/n/r/n. A Dutch study published in 2017 surveyed rates of sexual activity in older community dwelling people. Nearly half of those with partners reported sexual activity in the past 6 months. Rates were far lower in those without partners. /r/n/r/n. Another study reported that up to 40% of women over 60 had low sex drive. Still, the women said sex was an important part of their lives. /r/n/r/n. A 2020 study reported several factors that contribute to a declining libido after age 60. In addition to ED and menopause-related vaginal changes, they include /r/n/r/n. While some consequences of aging are unavoidable, many of them can be medically managed. /r/n/r/n. Both males and females report being sexually active in their 70s and 80s, and even into their 90s. /r/n/r/n. Age-related changes like erectile dysfunction mean these sexual encounters may not be the same as they were in younger years, though. Older adults often report that they prefer adaptive styles of sex that go beyond penetration. /r/n/r/n. While sex continues to be important at this stage of life, people may face more health challenges, mobility issues, and physical barriers to sex. For example, a study of older people with sensory changes, hearing, sight, touch, smell, and taste, found they were less likely to be sexually active, though this didn't affect the frequency or type of sexual activity among older adults who are sexually active. /r/n/r/n couples living with Alzheimer's disease or other dementia disorders may find new challenges with sexual expression. That said, more than 40% of people ages 80 to 91 who have partners reported they are still sexually active, though the rate decreases with cognitive declines. /r/n/r/n with people living longer. It's not unusual for older people to use dating websites or use smartphone apps to seek out new partners, even when marriage has ended through death or divorce. Sex with new partners can raise the risk of sexually transmitted infections, STIs, that you may not have thought about before, making it another good reason to talk to your healthcare provider about sex. /r/n/r/n While sex drive naturally changes over time, that doesn't mean you have to live with a lower libido. You can do several things to boost it. /r/n/r/n First, talk to your healthcare provider to see if it's a natural change or diagnosable sexual dysfunction. Depending on what they find, they may prescribe medication or help you find ways to correct it. /r/n/r/n If it is just an age-related drop, you may have success with lifestyle changes. /r/n/r/n To maintain or improve your baseline libido as you age, focus on taking care of your overall health, both physically and mentally. Improving chronic conditions that can impact libido is important, as is limiting stress and increasing natural endorphins with exercise. Focusing on exploring your personal desires, both with and without a partner, is also important. /r/n/r/n Exercise, activity levels, weight, and fitness all are related to libido. The good news is that even small increases in physical activity can boost sex drive, according to some research. /r/n/r/n Studies have also linked obesity and inactivity with sexual dysfunction. One study concluded that sexual behavior was directly linked to body fat percentage. /r/n/r/n Males with a high body mass index, BMI, an imperfect but commonly used measure of healthy weight, were 30% more likely to have erectile dysfunction. About 40% of them had problems with desire and 50% had performance problems. /r/n/r/n In females, heart health and cardiovascular fitness predicted arousal. /r/n/r/n Exercise may. /r/n/r/n While it's better to be active than inactive, you may harm your libido with too much exercise. Some research suggests regular, intense endurance training may decrease male sex drive. /r/n/r/n The best approach to diet is to choose foods that are part of an overall healthy plan, like the Mediterranean diet. There is research evidence to suggest real benefits for men with ED, or for women whose sex lives are affected by their weight. /r/n/r/n However, some foods have a reputation for increasing your sex drive. Many of them do this by improving blood circulation, and others by increasing energy. That's important for erections and also for female arousal. /r/n/r/n Others may directly increase your libido or improve your mood by changing brain chemistry. Libido-friendly foods include /r/n/r/n Be sure you discuss any dietary changes with your healthcare provider. /r/n/r/n Some foods can reduce your sex drive and function. Several of them lower testosterone levels, while others impair circulation. /r/n/r/n Libido-lowering foods include /r/n/r/n Soy and soy-based foods are sometimes said to be in this category, but recent research shows that they probably do not impact hormones or libido. /r/n/r/n A side benefit of avoiding trans fat and saturated fat is that your overall health may improve. /r/n/r/n Stress changes a lot about how your body functions. Chronic stress increases levels of a hormone called cortisol, which can suppress sex hormones and lower libido. /r/n/r/n It can also negatively affect your mood and mental state. That can also harm your sex drive by making it hard for you to get in the mood. /r/n/r/n You can lower your stress levels by /r/n/r/n When your body stops being chronically stressed, your hormone levels should return to normal. If you need help with stress relief, talk to your healthcare provider. /r/n/r/n Some research has linked poor sleep with low sex drive. Improving your sleep quality may help. /r/n/r/n The first step is to take a look at your sleep hygiene, your habits surrounding bedtime and sleep. To achieve better sleep, /r/n/r/n Better sleep may improve your health in many ways besides your libido, so it pays to create better habits. /r/n/r/n If your sleep quality doesn't improve with these steps, ask your healthcare provider whether you may have a sleep disorder. Getting it diagnosed and treated can make a big difference in how well you sleep. /r/n/r/n Research confirms what you may already know. Feeling emotionally connected with your partner increases feelings of desire and arousal. Women tend to need more of an emotional connection than men. /r/n/r/n To boost your desire for each other, relationship experts recommend /r/n/r/n If you have difficulty reconnecting with your partner, you may want to consider couples counseling. /r/n/r/n Research suggests that hormone therapy and reassignment surgery can lower the sex drive of transgender people. However, it appears to be a short-term change. Some research has found that trans women appeared to end up with a higher sex drive over time than they had before treatment. Trans men, overall, returned to their previous levels of desire. /r/n/r/n Male sex drive peaks in the 20s and then gradually declines with age. Female sex drive grows as the fertile years pass, then declines with menopause. But each stage of the life cycle offers different opportunities for intimacy and connection, with sex continuing into your 70s, 80s, and beyond. /r/n/r/n There's no set age when people stop being sexually active. You'll experience individual changes in your body across the decades, so talk with your healthcare provider about your sex life and what to expect. /r/n/r/n You can increase your libido with moderate exercise, dietary changes, stress management, getting better sleep, and staying emotionally connected to your partner. /r/n/r/n Sex drive fluctuates because it's influenced by many biological and emotional factors that all have ups and downs. Hormone levels, stress levels, age, illness, sleep quality, and a bad mood all play into your libido and arousal. /r/n/r/no, there's no universal normal when it comes to sex drive. Libido exists on a spectrum, so what's normal for an individual can vary widely. If you've noticed a change in your libido, especially a dramatic one, bring it up with your healthcare provider. /r/n/r/n Mismatched libidos can be hard to deal with, but you can get to a good place. /r/n/r/n If you've seen a change in sex drive in either of you, talk to a healthcare provider. There could be a medical reason. /r/n/r/n/r/n/r/n Thank you. Form.email, for signing up. /r/n/r/n There was an error. Please try again. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.